Hello, everyone. This is Mark Plaster, Senior Executive Editor of Emergency Physicians Monthly. And this installment of EP Talk is going to be a few episodes of my favorite book. No, not really. Night Shift. It's a collection of stories that I've put together over the last 25 years that all of you know are supposed to be fiction, but you can't make this stuff up. If you're a patient of mine and you happen to hear a story that sounds awfully like you, it's not. All of us, all emergency physicians, have seen 1,000 stories like this, so don't think it's you, and don't sue me for telling your story because no one will know if you don't say, "Hey, he wrote about me." But in any event, Night Shift is the kind of collection of stories that anyone who has worked at night in the emergency department can tell you. I saw a guy like that. I saw a case like that. I felt that way. So it's our shared collection of feelings and stories and experiences. So just sit back and relax. It may resonate with you. If it doesn't, I'm sorry, but this is my story. The next story is called, believe it or not, Bat Bite on Butt. That's what the chart said, right there under chief complaint. Nothing more. It had to be a joke the nurses were playing on me. They had done that before. They once sent me into a room with a chart that said cold. The patient didn't have a cold. The patient was cold and dead. That patient had been sent in to be pronounced by a funeral home, so this had to be a joke too. So when I got to the room, I found my frightened, embarrassed woman in a bathrobe. On the far end of the gurney was something bloody in a towel. When I asked her what happened, she pointed with a very shaky finger at the towel and said, "It bit me." When I opened it up to examine the contents, it took me more than a moment to recognize the beast. The fur and the face made it look like a rat, but sure enough, the shattered wings confirmed that it was indeed a bat. "Where did it bite you?" I asked. "Right there," she said, as she lifted her hip and pointed right to her rectum. "Okay," I said slowly. I wasn't laughing at the time, but I can't recall this without. How did this happen? I said. I was fully expecting to hear one of those kinky urban legends that had passed around every ED about some local celebrity. Everyone who tells one of those stories claims that it happened to someone else, but they know, to be honest to God, fact. Swear on a stack of Bibles. I was in bed and it bit me on the butt, she explained. Over the years, I have developed a technique for eliciting information without having to ask embarrassing, plain as the nose in your face, obvious but seemingly nonsensical questions. It looks like a cross between a math teacher's stare over the glasses and the moment before you belch. I call it the look. Most of the time, you don't even have to add the obvious question like, was there some reason you didn't turn off the garbage disposal before you reached in to get the fork out? You know, questions like that. Unfortunately, I had not mastered the look at that point in my career, and I was forced to ask the obvious. How did a bat get into your bed? I'll never forget this. It jumped out of my mouth. I had to ask. And then, how did the bat get into your underwear? That it mattered to my treatment plan? Not now. I was just plain curious. Well, you see, my bedroom has a huge window with no screens or curtains, she began. And since I like to sleep naked, I never turn on the lights. I just leave the covers turned down so I can jump into the bed and cover up. When I came to bed after my bath, I just must have jumped right onto the bat. I immediately began screaming, jumped out of bed, turned on the light, grabbed my softball bat, and began swinging for all I was worth. The neighbors got a real show, and I demolished my room as well as the bat. After examining the puncture wounds, I asked the bat was probably healthy. I explained that the bat was probably healthy and only bit her because she jumped on its head. Nevertheless, the remains of the hapless bat will be sent to the health department. She was relieved when I told her that we would begin immunizations for rabies without waiting for results. By the time she left, she was calm and ready to try bed again, but I couldn't help but wonder if her neighbors ever got the courage to ask if she thought she was Babe Ruth playing midnight naked softball. Another story. This one's called An Easy Decision. Baby won't stop crying was the chief complaint. How many times have I seen that in the past few decades? I never knew what to expect. It could be a baby with a simple nasal congestion. After all, babies are obligate nose breathers, right? If their nasal passages are blocked, they can't breathe, unless they're crying. But it could also be an infant with a life-threatening intussusception, where the bowel telescopes, within itself. A lot of things swirl through my mind as I traverse the 10 yards from the chart rack to the room. Oh, she was crying all right. The nurse had placed the mother and the child in the room and had closed the door in an unsuccessful attempt to dampen the sound. When I opened the door, it was like I had stepped onto a factory floor where everyone has to shout at each other over the high-pitched whine of 100 machines. This little girl was making herself known. Whoa, wow, I said instinctively as a blast hit my ears. What's the problem, sweetheart? I cooed to the baby, attempting to assume a soothing voice while reaching out to the mother. The heavy-set young mother was clearly at her wit's end. She nearly shoved the baby into my arms. She's been screaming like this for hours, she shouted over the racket. But then it was like someone pulled a plug on all the machines at once. The child's mouth slammed shut, and the room went silent. She immediately began attempting to touch my mustache with her tiny finger. I checked each little finger to see if she had a hair twisted around them like a tourniquet. Not an infrequent finding, actually. The mother sat dumbfounded. Really, she said apologetically, she really has been screaming like that for hours. What did you do? I don't know, I said, shrugging my shoulders. Are you sick, sweetheart? I was looking into her piercing blue eyes as she busied herself exploring my face. She had chubby pink fingers that perfectly matched her pink knit cap. Or are you just trying to drive your mama crazy? Sick or not sick? That's the question. It sounds so easy, and sometimes it is, but every time you get comfortable, beware. Without thinking, I began slowly bouncing in a waltz step while holding the baby. As I began my history, two conversations were going on simultaneously. One, on the outside, was my time-worn litany of questions to the mother. They seemed to roll off without conscious thought. How long has this been going on? When was her last wet diaper? Has she been around any sick children? And so on and so on and so on. On the inside was a cacophony of voices, some urging me to get on with the night's more important cases, some warning me to look for the telltale signs of impending disaster, some just telling me to enjoy the break from the drunks and the drug seekers. One of the voices, though, coming from the remote past, offered a bittersweet warning. He'll be fine, I told my wife after hearing her worry about our own 4-month-old. I think he's just coming down with croup, she said. Every kid in town has croup tonight, I said with a hint of exhausted irritation. I glanced at him when I got home. He did look fine, but I could see her eyes pleading for attention. As I had just finished a long shift in the ER at the local pediatric hospital, I was feeling too exhausted to consider the possibility of another sick kid, especially mine. I realized now that what I knew then was just enough to be dangerous. A little voice inside my head was arrogantly saying, "You're the doctor. What does she know?" "Put him in here with me," I said, finding a compromise. "I'll watch him while you get a little rest." I absent-mindedly took him from her arms and plopped down on the couch to watch some playoff football. Go on, go on, go on to bed. I know you're tired. I'll get up if I need. I'll get you up if I need you. I sounded considerate, but really I just wanted her to quit staring at me so I could watch football. She finally left the room. I became engrossed in the game, ignoring my infant son's quiet, grunting respirations. How's he doing? My wife asked, coming back into the room after less than half an hour. She stood in front of the TV, vying for my attention. I thought you were going to bed, I said, trying to look around her at the screen. I thought you were going to watch the baby, my wife insisted, taking the baby from my arms. I think he's sick, she said. I could hear her genuine anxiety rise in her voice as she shoved our little boy into my face. Only then did I notice the slight gray cast to his skin, indicating the falling oxygenation of his blood. I also noticed that, to my increasing panic, his respiratory rate was slowing down, not from relaxation, but from fatigue. A few more minutes of this and he was going to stop breathing. It took my breath away. I think we need to go back to the hospital, I said slowly to my wife, trying to appear calm. It was as if I was speaking to someone who had just stepped on a landmine and had not yet triggered an explosion. The drive to the hospital was quiet except for our baby's soft crowing. As was to be expected, he had improved by the time we arrived. Being exposed to the cool night air had reduced the swelling in his airway just enough to avert a disaster. Tom, a fellow classmate in my emergency medicine residency program, was still on duty in the ER. Seeing that my son had improved, I suddenly felt apologetic for bringing him to the hospital. I'm telling you, I said to my friend, he looked really sick. Gray, huh? Tom said with a shrug. I guess we have to get an ABG. Do you have to? I felt pain. I felt the pain of what he was about to inflict on my son. What's he going to do? My wife asked. He needs to draw blood from the baby's artery to check the oxygenation, I said to her. It was the first time I'd experienced the consequences of my words. Many times before, I had questioned the observations of patients and demanded a blood test to prove or disprove what they reported. I, like the parents I had previously discounted, now wanted to bypass the evaluation and the workup and get right to the therapy. You can see the pulse ox is low, I said, trying to negotiate with my colleague. He's cold, and that could be closing down his peripheral circulation, he countered. He may not be as sick as he looks. Besides, wouldn't you order a gas on some other kid if their parents said he had turned gray? Despite the fact that he was holding out a false hope, I knew Tom was right to do this one by the book. Let's go for a walk, I told my wife as I pulled her out of the room. Let's allow them to do their work. My wife still swears that she could hear our little boy's cries from the other end of the hospital. He was hypoxic and acidotic, Tom said when we got back. We got cultures and did an LP just in case he was septic. I didn't wait to get a signed consent from you. I assumed it was okay to proceed. Our son was already surrounded by nurses who were starting an IV in his arm. My heart sank with the possibility that he could indeed be much sicker than I had expected. My wife looked at me, cocking her head as if asking me to translate what my colleague had just said. His blood oxygen was low, and his pH was too, I told my wife as tears welled up in her eyes. He's a sick little guy. There could also be an infection, so they drew blood cultures and did a spinal tap just in case. He'll need to go to the PICU just in case we need to tube him, Tom reported. Try not to if you can, I began to plead, but before he could return a reasoned response, I stopped him. Just do what you have to do. I didn't need to interpret the intensive care acronym or the intubation reference. She had heard me talk about other babies facing life and death situations and understood the gravity of the situation. I spent the next week working in the PEDS ER by day and sleeping in the PICU waiting room at night. In an effort to hold off intubation, the intensivist had placed him in a respiratory tent containing oxygen and helium. The heliox mixture was meant to decrease the airway resistance in his lungs. It was sort of like a lubricant to his scratchy, swollen bronchi, but it made his crying sound more like a duck than a baby. Each time I went in to see him, he would reach out for me and cry. His tiny little chest would collapse almost to his spine as he attempted to breathe on his own, but when I touched his tiny little hand, he would smile and then return to quacking. Do you have children? The mother asked after all my questions had ceased. Her query broke the magic spell of my little dance partner and me. Yes, I smiled, suppressing the urge to pull out pictures of children and grandchildren. I finished the exam looking for petechiae between the toes, checking for nuchal rigidity several times, and any other signs of a severe infection or other potential catastrophes. I covered every base before handing her back to her mother. She immediately started to fuss again. That's frustrating, I said. I thought we had her. Let's try feeding her and see how she does. I don't hear you telling me anything that raises red flags. The vital signs are fine. The physical exam doesn't show me anything. Let's see how she does, and then we'll decide whether we need to do a workup. This little one didn't meet the standard measures for a sepsis workup, but I wouldn't have hesitated to do it if I thought it was necessary. I do not like the idea of doing shotgun tests when you don't know what you're doing or what you're looking for, but I had to show the mother that I was trying. Despite all this, there was something inside of me that said this little girl was not sick. Several times I popped back into the room to observe the infant. I realized that I had done nothing except dance around the room with her and talk to the mother. The baby was a little charmer, still fussing and crumping, and now only having brief periods of screaming. Was she sick or not? Sometimes I really wished I'd gone into orthopedic surgery. All you have to do is look at the x-ray. Either it's broken or it isn't. Finally, it was time to fish or cut bait. The baby was back to screaming and the mother was looking exasperated. I walked back into the room and picked up the baby again. This time, her screaming continued unabated. The voices lobbying for sick were also getting louder in my head. I guess we'll need to check some things on your daughter, I shouted over the roar as I danced around the room, wildly patting her diapered bottom. The old magic just wasn't working for me this time. All of a sudden, there was an explosive squirting sound that came from her diaper. It sounded like I had jumped over on 20 ketchup packages. I peeked in her diaper and found a huge, stinky mess. Whoa, little girl, did that come out of you? I said to the cutie in my arms. She stopped screaming, looked at me with a look of dreamy satisfaction, and fell sound asleep. Was that all it was? I asked myself aloud. I looked at her for a long moment. Now she appeared perfectly normal. I looked at the mom, who was smiling. I hope she doesn't think I'm going to change that diaper, I thought, quickly shoveling the baby back into her mother's arms. The mom just took her head disapprovingly. I had seen that same look from my wife many years before. You need a diaper or some wet wipes? I asked, beating a hasty retreat to the door. Thanks for listening to these stories from Night Shift. If you'd like to obtain a copy of the book, you can email me at erdocmark, erdocmark @gmail.com. Again, that's erdocmark @gmail.com. And for a mere $20 plus shipping and handling, I'll get you the book, and I'll even sign it for you if you'd like. But these are our stories, and if you're an emergency physician's family member, spouse, child, grandchild, and you'd like to know what your mom or dad have been doing over the last years when they've been off at night, maybe this is the book for you. Thank you for joining EP Talk. This is Mark Plaster. Thanks for joining me.